Hi, today I'm talking about UTI, urinary tract infection. One of the most important things that people catch UTIs is because A, they haven't drank water, or B, they had diarrhea, or C, they're constipated. They're severely constipated due to dehydration, and they're not aware of it. According to them, they're eating good, but they're still constipated. Um, so we're going to talk about all these subjects. The reason why, as a physical therapy assistant, I feel like I have to talk about this is most of my patients, when they're making progress, if they catch a UTI, they go back even before what they started because they got loss of balance and they're confused. So we can avoid these two things if you first manage your dehydration or electrolyte imbalance or whatever it is that's going through. So, if you're having a urinary tract infection, the first thing I want you to check out is if you can get fresh fruits and vegetables. I'd rather you eat fresh vegetables, broccoli, bittergourd, anything that's bitter, the better it is for your life. So try to find those vegetables and eat it. My standard sentence that I give all my patients is either you could eat 3 cups of vegetables without the carbs or 15 prunes. So either or you can choose to eat. And it's important that you have enough fiber in your body. It helps the motility when you have other medications that you're taking that slows your digestion down. If any questions with anything that I'm asking or saying, you have to verify with your doctor, and they would tell you the what's according to your body type, what is beneficial for you. Every person that I'm talking about is different. What works for me will not work for someone else. So that's why I specifically say always have a conversation with your doctor what you need to eat and what you're supposed to drink. When I have UTI, what I do is I usually take my body weight, I cut it in half, and then I drink that much ounces of water. Now, I love coffee. You cannot take coffee from me anytime. If I want to drink coffee, I have to add 2 more cups of water to my amount of water that I'm drinking. But now, what happens for me does not work for another person. So you have to run from your doctor. I drink coffee, I drink my Ensure, I drink such and such. How much more water should I drink? They can tell you exactly what you need to do. They are paid to help you out. So get the information you need. Okay, now if you're having diarrhea, your electrolytes are messed up. You need to fix it. Here we get Gatorade. We buy the Gatorade powder, we mix it with water, we have different flavors. So people who are not drinking water, we get them to drink it. Now, if you're diabetic, you cannot have all that stuff. So I recommend you learn to make buttermilk. It is yogurt. You put like a 1/4 teaspoon of ginger, put in a blender, put some salt into it, and you can drink it up. If you're not diabetic, lemonade with salt. Can't go wrong with that. You always will be. But it has to be fresh lemon, not the lemonade powder. Lemonade powder is not vitamin C. The purpose of drinking lemonade is for vitamin C also. And the oils of lemon is very healthy. It does make you less nauseous and more appetizing to eat. Appetizing being the right word. Anyway, let's see. Next topic that I forgot to talk about is hand washing. Um, I wash my hands all the time. So does most of the people. The soap that you're using may cause an allergic reaction. There are 100 different types of soaps now. So look for hypoallergenic soaps or more gentler soaps for you. Only by trial you will know which is safer for you. Find less abrasive soap for you. Same if your partner is using that same abrasive soap, it is going to be very, very likely that you're catching UTI because of that. So tone down the soap quality, um, which will be safer for you. Now, don't not wash hands. You will have to find, we have soaps that are like seventh generation we use for dishes. We have soaps that are hypoallergenic soaps for body wash and all that stuff that we buy that is specifically for gentler skin. Even the eczema soaps are safer to use for people. Aveeno is number one that is very beneficial for people. Next thing is clothing. Um, Along with soaps, the some people have severe reaction to Tide. Um, is it the phosphorus? Is it anything else? It's not just Tide in general, it's any soap. You have to find a hypoallergenic soap for washing your laundry. If it is not changed, the chances of getting UTI will happen again and again. So change your laundry soap. Another thing, the underwear that you wear, it has to be cotton. If it is nylon, if it is any polyester, heat and humidity in hot countries will make you catch multiple UTIs if it's not dry and clean. So I want you either buying 1,000 underwears or buy cotton underwears. Um, I have to tell you next is my favorite part, uh, exercises. In general, all my patients, I tell them to walk 2 hours. Um, Being that your heart needs the exercise, whether you're sick, you're tired, whether you need to go exercising, it's very, very important for the heart. I didn't ask you to run. I didn't ask you to do yoga for 2 hours. None of that. I want you to walk. Gentle walk at your own pace. You are in charge of you, so compete with yourself, how you can make yourself better at getting your heart rate up higher level, so it will make you increase your appetite, make you have a healthy habit of drinking water, and keep you cognitively more alert. The more you exercise 2 hours, it actually affects your brain. Your posture changes too. So I'm going to go to the exercises next. We're gonna start with my yoga mat. Let's go over here. For my first exercise, I don't need a pillow, so I'm gonna put that away. We're gonna start with bridging. So you're gonna lie down, keep your knees bent, feet flat on the mat, of course, move away from your head, and then all you're gonna do is you're gonna lift your bottom up in the air. So tighten up your belly, tighten up your butt, and then go. Hold it for 5 seconds. 1, 2, 3, 4, 5, and then drop it. So you're going to do this 30 times at home. For this YouTube video, I'm only doing it 5 reps. Again, hold your stomach in, tighten up your butt. 1, 2, 3, 4, 5. Again, do it again. 1, 2, 3, 4, 5. Again, 1, 2, 3, 4, 5. And let's go again. 1, 2, 3, 4, 5. Excellent job. Next one, I want these, find nice cushions or pillows. Settle them down by the bottom of your feet. And you're going to lie down. I want you to practice tapping them. Tighten up your belly and tap them. 2, no holds. 3, keep the belly nice tucked into the spine, okay? 4, 4, 5, 5. Okay, one more extra credit. That's it. Next exercise that we're going to do is the cat camel. Oh, the dead bug. Let's do the dead bug. So the next one we're going to do is you're going to keep your hands and knees bent. You're going to lift up opposite arm and leg. So if I'm lifting up my right hand, I'm lifting up my left leg. So to see it easier, you're going to pick up the right hand, left leg. Bring them almost close to each other, put them down. Lift up your left hand, right leg. Bring them close to each other, drop them down. Once you get it, you can speed up. Okay? 3, 3, 4, 4, 5, 5. But try to coordinate it so that both arm and leg come together in line here at the same time. Okay? Another simple exercise you can do is just 1, 2, 3, 4, 5. Very good exercise for you guys. You can have the pillow there or not, that's okay, that's up to you. For the next exercise, I'd rather have you get a chair if your hip is bothering you. If your hip doesn't bother you, you can put your hands on the floor and you can do it this way. So go like this. Okay? 4, 4, 5, 5. For those who have hip issues, they cannot do it. So I'd rather they have a chair that is sturdy, that will not move. They can do it there. 1, 1, 2, 2, 3, 3, 4, 4, 5, 5. Next exercise is marching in place for 30 seconds. Next is the most important part. We're going to do a little bit of stretching. Most important stretching to start with, put your hand on the hip, reach out to the side, and go as high as you can. The higher you go, the better it is. Hold it for 30 seconds, and then relax. Then go to the other side, reach out for 30 seconds. Hold it for 30 seconds, and then you can stop it. Okay, so again, do it 2 more times. Reach out, hold it for 30 seconds. So when you're holding it in like this, when your hand goes up to the sky, I want you to breathe in. So tighten up your belly and breathe in. Tighten up your belly and breathe in. All right? So the same thing. Bring your hands up, tighten up your belly, and breathe in. Tighten up your belly and breathe in. Excellent job. Next one, you're going to work on your rotators. Reach out, reach back behind you as much as you can. Breathe in, breathe out. Breathe in, breathe out. Don't forget to tighten up the belly first. So reach out. All your back muscles got to stretch when you're doing this. Tighten up your belly. Breathe in, breathe out. Okay, what else? I'd rather you eat as much cranberries and cherries. They are fresher they are, the better it is. Don't go for the juices. Juices don't help you. They are sugars. They are actually help the bacteria to survive. So anything non-sugar is safer. For 7 days, try to stay away from sugar. That means desserts, in your coffee, in your tea, even the fruits. I'd rather you stick with vegetables. Can't go wrong. Stay less carbs. Carbs are a natural sugar for the body. So if you go 3 cups of vegetables and meat, you will make up for the carb that is not there for 7 days. And you will actually help yourself. Remember to change your soap. Have no coffee or sodas. They're high irritants for urinary bladder, and that'll make you urge to go. So if you could avoid it, it'll be a little more easier on you. but it's still your body, your choices. You can always opt to drink 2 more cups of water added onto it. Alrighty, if any questions about pelvic health in general, check my previous YouTube videos. Okay, have a nice day. Next will be soon.